Fidel Castro.
Mao Zedong.
Joseph Stalin.
Kim Jong-il.
Communism is a system of government in which the state plans and controls the economy, and a single, often authoritarian party holds power, claiming to make progress toward a higher social order in which all goods are equally shared by the people.
National Healthcare is healthcare coverage which is extended to all eligible citizens of a governmental region. The central government's control of the medical industry. All citizens receive equal medical coverage.
I dislike nationalized healthcare because it has a bad track record. For instance, Hawaii's attempt failed miserably after a few short months. Great Britain's system is failing, and Canada's is subpar at best.
I dislike nationalized healthcare because it's a completely inefficient system. The government has the power to decline coverage if the procedure is too risky, complicated, or expensive. Care that would normally be available in a few short hours may take weeks or months due to long waiting lists.
I dislike nationalized healthcare because it takes away privacy and freedom. Someone else's personal habits and practices could affect me personally. If they do not take care of themselves, then I am obligated to pay for their medical coverage. The government may also pass legislation to prevent citizens from participating in unsafe activities, like riding a motorcycle or eating unhealthy foods.
I dislike nationalized healthcare because once you equalize healthcare, salaries in the medical field are equal and lower. The incentive to become a doctor will be lost because the financial reward will not be present. The quality of care by doctors will be lower because there is no motivation to work harder if you are paid at the same as your peers.
Okay, for our first question, if nationalized healthcare is put into practice, do you believe that it will affect the quality of the healthcare from other doctors?
I think it probably will, primarily because it's going to be kind of like the emergency room where you have a lot of people coming into the emergency room with all kinds of complaints, from anything from the cold to actual emergencies, and because they're getting free health care, so to speak, you're going to have a lot more people coming in being seen appointment-wise. So it's going to exponentially increase appointment times for the doctor.
Okay, do you believe that when nationalized healthcare, if nationalized healthcare is put into practice, that the quality of the medical staff that we have today will be affected due to everybody getting the same treatment and it's free for everybody, basically?
Well, I'm not sure the quality of the health care is going to go down per se. I think probably one of the primary problems that you're going to see in a nationalized healthcare system is a really high burnout rate. One of the problems there is that you have a lot of docs who are specialized in what they do. You take an ER doc and essentially does nothing but emergency care, and if he has a guy who's either a drug seeker or he's just coming in for a cold and you're getting that constantly, he's not actually getting to practice what he wanted to practice, you're probably going to see more burnout than the average guy. You take a guy like me who's doing mostly family practice, and then I get a lot of people who with nationalized healthcare, and I'm getting a lot of appointments that are unnecessary for a multitude of things that could easily be taken care of in another manner. Then if I get a high burnout rate, then yes, that could affect the quality of care.
Okay, next, do you believe that with nationalized healthcare that the pay, depending on the specialty of the doc, will be equal across the board? As in, will they all be paid the same because every person is getting free healthcare? Do you believe it'll also equalize the pay for the job?
That I'm not sure of. I think a lot of that's going to depend on how the government intervenes in what a doc gets paid or doesn't get paid. I don't think that it's going to be possible to equalize care across the board. I mean, you can't just say that a surgeon should get paid the same as a family practitioner versus an emergency room doc. But if you go to a nationalized healthcare system, it's definitely going to be dictated by our government as opposed to a capitalist society where pay is dictated by those that are involved in that particular society, whether it be the insurance, HMO, etc. So it's not going to be equal across the board, but it's definitely going to change, and it's probably going to change for the worst for some, and it's going to be better for others. In something like this, like a nationalized healthcare system, the persons who are probably going to see the most pay are going to be the administrators.
Okay. As far as your job is concerned, do you believe it'll make your job harder due to everything being free? I mean, obviously, when things are free, there's going to be a lot of people who want it. Do you believe it'll make your job harder or easier?
I think it's going to make my job a lot more difficult because I'm going to be seeing a huge variety of patients from all walks of life. One of our big stoppers in this society is the emergency room, and that's difficult for people from all realms. You get a lot of drug seekers, you get a lot of people coming to be seen who can't pay for their own health care, and the funnel for that is the ERs. If you make it nationalized across the system, then they're free to go and see anyone. So if I'm averaging anywhere from, say, 20 to 25 patients a day, then it's probably guaranteed that I will have to increase the numbers of patients that I see in order to be able to maintain those numbers.
Okay, this has been Brian DeMio. Thank you for your time, and we appreciate this interview.
You're welcome.
I dislike nationalized healthcare because once you equalize healthcare, salaries in the medical field are equal and lower. I dislike nationalized healthcare.
Pay for the medical coverage. The government may also pass legislation to prevent citizens from how do you?
Great Britain system is failing, and so man, shut up.